Welcome to our Week 10 review for ST210 Microbiology. We are focusing on chapters 21, Control of Microbial Growth, and chapter 22, Emerging, Reoccurring, and Reappearing Diseases. Now, I'm going to guide you with prompts and hints for the one question in this week, exercise 2. But remember, it's not about memorizing the answers. Instead, it's about learning how to analyze, connect concepts, and use your textbook as resources. No answers here, just guidance. So let's begin with our question. Explain antibiotic resistance and provide at least 2 examples of how it spreads. So what makes antibiotics one of the most commonly prescribed medications worldwide? How can misuse or overuse of antibiotics in humans contribute to resistance? What role does agriculture, particularly in food animals, play in this issue? How might resistance spread through communities or hospitals once it develops? And why is inappropriate prescribing so concerning for our surgical patients? Now, in chapter 21, refer to the section on antimicrobial agents and resistance patterns for a really good breakdown on how bacteria adapt. Also, imagine you're in the operating room and a surgical site infection occurs post-operatively. How could antibiotic resistance complicate both the treatment plan and patient recovery? All right. Now, keep in mind, antibiotic resistance and microbial control aren't just classroom topics. They have real consequences in patient safety and outcomes in the operating room. Remember, our role as STs is not only about sterile technique, but also about understanding the science behind infection prevention. Keep practicing critical thinking, lean on your textbook for depth, and always connect the material to clinical practice.